The United States declared measles eliminated in 2000, but a series of nationwide outbreaks this year shows the highly contagious childhood illness is still very much with us. More than 300 cases so far this year. It's more than the total number of measles cases in all of 2024. Health officials are warning Wisconsin is at risk of a measles outbreak because state kindergartners have one of the lowest measles vaccination rates in the country. Let's get more information on why this measles outbreak is a concern and how we can protect ourselves. We're joined by Dr. Ben Weston. Dr. Weston is the Milwaukee County Health Policy Advisor and an associate professor at the Department of Emergency Medicine at the Medical College of Wisconsin. Thank you so much for being with us. We're fortunate that you are a regular guest here on Connect NKE when it comes to all things health.
I'm glad to be back with you. Thanks for having me.
Thank you. We should probably start with measles 101. What is measles and how is it spread?
Yeah, so measles is a viral infection. And the way it's spread is that it's extremely contagious. And so this is the kind of thing when you're just in a room with somebody with measles, and just from the air in that room, you're about 90% likely to be exposed to the virus. And if you're not protected, to catch that virus as well. Now, measles starts off like a lot of different viral things with your typical flu-like illness. You might have fevers, you might have chills, but then it progresses to a rash typically, and that's the measles rash that we've seen, this full body kind of rash. And then it does one of two things. Hopefully you get better, but unfortunately the problem is too often you don't get better. And so 1 out of 5 people, 20% who get measles end up getting hospitalized, which is a really high hospitalization rate. 1 out of 1,000 get brain swelling, and actually 3 out of 1,000 die from measles. And so when your numbers are extremely low, these numbers are low, but as measles cases increase, you start to see much more serious adverse effects.
When you go through those symptoms that parents need to look out for, the adults who haven't been immunized need to look out for, it's a little scary because it sounds like it could be any kind of late spring cold or flu potentially.
Yeah, that certainly is how it starts. And of course, we don't want to get too worried when we just have cold or flu-like symptoms. But certainly if it progresses to a rash, and certainly if you are not fully vaccinated against measles, then you need to worry. In fact, right now with the outbreaks we're seeing, if you are not fully vaccinated against measles, this is a good time to worry, but also to be proactive and go out and get yourself or your child fully vaccinated against measles.
Let's talk about who needs to make sure that they are fully vaccinated against measles.
Well, I'd say everyone. Everyone should make sure. Now, maybe you know because you know you got all your vaccines as a child and you've kept up throughout the years. But if you're not sure, you can go on and check. So in Wisconsin, you can go to the Wisconsin Immune Registry, WIR. It's easy enough. You put your information in, you get your whole vaccine list of everything you've received in Wisconsin if you are a Wisconsinite. But certainly if you have not received those vaccines, you would want to go out and get your measles vaccines. And if for some reason you're otherwise concerned, sometimes people with extreme immune compromise, especially if they're around during an outbreak, may want to get vaccinated again. That would be pretty unusual, but that's something you'd want to talk to your healthcare provider about.
And are there some people who kind of fell in an age group where they probably are too old, or they're probably old enough that they got the measles, but they may have only had one vaccine when they were a child? Should those folks go back and get that a second shot?
It's a good question. So most people generally don't need to get the second shot. Even if as a child back in the 50s, potentially, you got measles, you have the immunity then. Or if you got your vaccines in the 60s, you still have immunity. Now, there's a caveat. Since you asked, if you got your shot from 1963 to 1967, it's pretty specific. But if you got your shot during that time, it was a time when the vaccine wasn't quite as effective. And so you may want to talk to your doctor about getting updated booster or just the same vaccine again to protect yourself from measles.
One thing that people may be doing in the next few weeks is they're going to be traveling on spring break. Is there a concern that people are going to be in areas where there's exposure and we're going to see measles here in Wisconsin before we know it?
Yeah, it certainly could be. I mean, we're seeing little clusters of measles around the country, but without a doubt, Texas, New Mexico, and now Oklahoma are where the outbreak really is occurring. Of those 321 cases, about 300 of them, more than 300 of them, are in those 3 states, especially in Texas. So if you're traveling to those areas, certainly it's something you want to be aware of. But again, most people are fully vaccinated. If you've kept up on your vaccines, you've kept up on your children's vaccines, you should be fully vaccinated against measles. And it's important to remember this is a vaccine that's been around for 50 years. We know it's safe. There's been lots and lots of data around it. It's also a vaccine that's highly effective. With the two-dose regimen that is the standard, you get 97% protection against measles.
That is good information for us to have. Dr. Ben, thank you so much for being with us.
Absolutely. Thank you.
For more information, you can talk to your doctor or visit the Froedtert and Medical College of Wisconsin website at froedtert.com/measles. We're back in just a minute.